Hi friends, happy to be here again and presenting to you the pearls of treatment for acne scars. Okay, so I'd like to acknowledge the Aesthetic Clinics Cosmetic Surgery team. Acne scars are a persistent complication with a lot of psychological and physical distress. And these are the pearls of treatment. Assess the type and extent of scars correctly to judge the treatment modality. Active acne must be treated to prevent further scarring. Assess the skin sensitivity, especially if you're thinking about peels or laser therapies. Assess the urgency of treatment. What is the timeline that the patient has? Why does he want to get the treatment, etc. Availability of resources and expertise, whether you have the lasers, you have the equipment, etc. to treat. Explain the expected outcomes clearly and correctly. What is the expected outcome? How many sessions will be required, etc. Patient compliance should be judged, especially for treatments which require multiple sessions, and of course, the economic feasibility for the patient. Now, different types of acne scars ranging from macular disease, mild, moderate to severe disease. Severe disease basically are hypertrophic and ice-pick scars which are there. This is how you assess clinically. The first picture, macular scars, no atrophy, no depression, just flat scars, hyperpigmented. The second picture is atrophic scars, has box scar, rolling scar, ice-pick scar. Box scars are punched out. Rolling scars, if you stretch the skin, the scar disappears. That's a rolling scar. And ice-pick scars are the tiny but very deep scars which are punched out, very, very deep scars, most difficult to treat. And then you have the keloidal scars in the last picture there, which is different modality of treatment completely. Okay, this is how these scars look on cross section. All of them have fibrous strands which are pulling them down, all the atrophic scars, and these strands have to be released if your treatment has to be successful. Treatment modalities for atrophic scars: if they're superficial, treat with peels, microdermabrasion, needling. If they're deeper, treat with lasers, fillers, surgical techniques, or a combination. If they're hypertrophic, treat with intralesional steroids, pulse dye laser, or cryotherapy. Chemical peels, easiest modality of treatment for superficial acne scars, does very well. Multiple sessions required. Post peel care is mandatory. Sun protection, hydration is what is required. That needs to be emphasized to the patient. Types of peels available: there are so many peels that are available. Common ones are salicylic, glycolic, TCA, and combination peels. Very, very good results couple of sessions down the line. Now, another modality is dermo peel, which is microdermabrasion plus chemical peel in the same session. First do the microderm, then apply the chemical peel and keep it for some time. Very good results for superficial acne scars again. Now, if you have deeper scars like this, you need combination therapies. I'll tell you one of the techniques that we use. This has been published. It was an invited review in Dermatologic Surgery recently, published by the Aesthetic Clinics. After starting this modality of treatment, believe me, we have literally cut down, or we haven't had to use surgical modalities of therapy for acne scars. So what this includes is you do subcision, release the scar, and induce collagen. So subcision releases the fibers which are holding the scar down. Hyaluronic acid filler raises the bed of the scar so that the laser can target it better, and also prevents reattachment of the strands to the scar after subcision. And then we do a fractional carbon dioxide laser to resurface and collagen remodel. This is to show you the video. This is subcision. So 26 gauge needle under the skin, break the fibers, use a back and forth or a fanning technique to break the fibers. As you can see here, there's some amount of bruising and edema under the skin, which helps to remodel the collagen. This is how the subcision is done. Then we go ahead and put a hyaluronic acid filler in the same session with a retrograde deposition. I'll show you that as well. So that's the retrograde deposition in the same session right after the subcision. Okay, so that's filling up the scar and also will prevent the reattachment of the strands which have been released after the subcision. And thereafter, this is the appearance of the space immediately after this. Then 1 week later or 2 weeks later, you do the fractional carbon dioxide laser. Number of passes depend upon how severe the scar is. You need multiple sessions. This is the fractional laser which is being used. That's a fractional beam, so you cover the entire thing. Multiple sessions of this laser, typically at 6-week intervals. Look at the fabulous results that you get with this combination therapy. This is a very severe grade acne scarring. Look at the results. Combination of subcision filler and fractional carbon dioxide laser. These are the results, okay? And very, very deep and ice-pick scars, you have to use a technique called as TCA cross, wherein you stretch the scar, dip a toothpick in TCA 80% or 100%, go to the depth of the scar, deposit the TCA, get immediate frosting, then you have scabbing, and then the collagen remodeling starts. Typically, you can do this particular technique, say about once a month to give you good results, and then you can combine the lasers thereafter. So that is a treatment for deep ice pick scars. So these are the pearls of therapy. in a nutshell. Assess the scars well for you to judge what treatment is required. Prevent active acne recurrence. So treatment of active acne is extremely essential. Combination therapies generally work better in atrophic scarring. Oral isotretinoin low dose has been found to be very effective in collagen remodeling and treating acne scars. So along with these therapies, if the patient is on low dose isotretinoin, typically 10 milligram thrice a week is what we do, it gives a very good result, and I found it to be really, really helpful. Of course, anti-scarring creams should be used. Post-procedure proper skin care is extremely important. Please emphasize this to the patient. Please take regular photos for documenting the improvement over serial sessions, and explain the requirement of multiple sessions and the expected outcome clearly right in the beginning. Thank you so much.